An aneurysm of the brain is essentially a weak spot in the blood vessel in the brain. It usually happens at this point where the vessel divides into two branches, so-called bifurcation. And for unclear reasons that we're still not fully understanding of, perhaps a jet of blood flow hits that spot a little harder, and it tends to weaken the vessel, and that can actually slowly form into a small bubble that, under certain circumstances, or if it continues to grow, can rupture. Most aneurysms are usually asymptomatic. People don't know they have them. When aneurysms get to a certain size, they may start to compress normal structures in the brain or other normal nerves. In that case, you may actually have some symptoms related to that. So if an aneurysm was large and compressing on the optic nerve, you may complain of decreased vision or some blurriness, or you may have headache, or you may have double vision, and so on. But the majority of aneurysms are actually too small to cause any symptoms, and on occasion they can cause headache. When an aneurysm does rupture, patients complain of the absolute worst headache of their life. They complain of neck stiffness and sensitivity to light. More importantly is sometimes you can have a small minor version of that where the aneurysm may have what's called a sentinel leak, or a tiny little bit of a leak that can cause a bad headache that can persist for a couple of days and then goes away. That's quite an important complaint that needs to be taken to your doctor, because it may be a sign of an impending actual significant rupture. We unfortunately still don't know what causes aneurysm to proceed to rupture. We know that smoking is bad and can actually weaken the blood vessels in the brain, and can sometimes contribute to moving towards an aneurysm rupturing. There are other medical factors such as a family history. There is a genetic component to aneurysms forming and aneurysms rupturing. Obviously, we can't control your family background or your genes, but that has implications on screening some of the other family members and having perhaps a closer follow-up. And so it's very important to explain to the patients the natural history of aneurysms, that up to anywhere from 0.5 to 2% of the population harbors an aneurysm of some size in some location. But it's important to know whether there's another family member that may have been affected by an aneurysm, or sudden rupture, or possibly a sudden stroke, because the presence of two family members with aneurysm means that the family is likely to have what's called a familial aneurysm history. And that has significant implications for the extended family. Everybody who is blood related to you would need to undergo a screening with an MR angiogram. The two ways of treating aneurysms include the conventional established microsurgical clipping. In that procedure, we actually perform an operation under the microscope and actually isolate the vessel that leads to the aneurysm under the microscope, and basically place a clip at the neck or mouth of the aneurysm, thereby preventing the blood pressure from reaching the weak spot. In the last 15 years, there has been a new method of treating aneurysm that is much less invasive, and that's one of the things that we specialize in here at Tufts Medical Center. It's a process called coiling. And in that, rather than doing open surgery and putting a clip on the outside of the aneurysm, you actually travel through the vessel, starting from the femoral artery in the groin, and actually fill the aneurysm from the inside, so that you can actually treat the aneurysm without having to have an actual physical incision, on your scalp, or actually have a formal craniotomy. Obviously, not all aneurysms are candidates for that kind of treatment, but increasingly, with the use of special devices, special coils and special stents that can actually help buttress the coil in position, the majority of aneurysms are actually treatable in that way. Our approach here at Tufts Medical Center is that we like to spend time with you and try to get all the information that we have that's available out there in terms of the best, latest research on the natural history, the method of treatment, the tools that are available. We're one of the busiest centers for doing stent-mediated coiling, which is the most advanced form of endovascular treatment. And we also treat aneurysms by conventional microsurgical clipping as well. So we present all of these options to you. They each have their benefits and drawbacks, and also look at the risk of treatment of these aneurysms and come up with the best treatment plan for you.